welcome to Conway on the Record. This is the official podcast of the Log Cabin Democrat. I am your host, Drew Mitchell. We are joined today by Jeanette Anderton, the editor of the Log Cabin Democrat. Jeanette?
Hello, Drew. How are you?
I'm doing wonderful. And Matt Troupe, the president and CEO of Conway Regional Health System. Matt, welcome to the program, sir.
Howdy. Happy to be here. Thank you for having me.
Well, we appreciate you joining us. We're going to be talking today about, of course, COVID and how, that affected things. And I'm sure it did. And the healthcare challenges involved and vaccinations and all that good stuff. But first, we'd like to get to know you a little bit more. How did you find yourself to be in this line of work, I guess is a good place to start.
Well, that's a long story that goes way, way back to the early days of my childhood. I am the youngest of 5 kids. Grew up in the Dallas area, really kind of in central Dallas. And my mom worked for UT Southwestern in Dallas and worked for a physician there. And she would come home at night and talk about her job and some of the challenges the person that she worked for faced every day. And I really, from a very young age, was fascinated by healthcare and kind of the business aspects of healthcare, and how healthcare is this really cool confluence of ethics, business, legal, regulatory issues, and all the while really making a meaningful difference in people's lives and in the community. And so I just was really fascinated by healthcare, and had a brother-in-law who was studying to become a hospital administrator. He was in graduate school. And so got to learn more about that particular track, because up until then, I didn't really know that there was such a thing. I thought everybody that worked in hospitals was a doctor. And sometimes I think my kids still think I'm a doctor. But anyway, yes. So I just really piqued my interest in, not to date myself, but to sort of date myself. When I was going through undergraduate school at Texas A&M University, it was around the time of Hillary Clinton's, health plan, and there was a lot of nationwide, conversation and debate about that health plan and what it meant, and just really became even more engrossed and fascinated by it. So from there, went to Trinity University in San Antonio for my master's degree, and then we do what's called an administrative residency, which is kind of modeled after a physician's residency, although it's only 1 year in length instead of 3 or 4 or 8, in case of what kind of doctor you are. And I did that residency in Dallas at Presbyterian Healthcare System, and grew within that system, and have spent a little bit of time in Oklahoma, spent a little time in Florida before coming here to Arkansas in 2014. So,
okay.
Yeah.
Well, and I'm sure 2020 was a year like y'all have not seen before.
Quite unprecedented.
Yes,
I'm trying to eradicate that word from my vocabulary, because I've used it entirely too much over the last 14 months. But yes, very unprecedented.
Yeah. Well, I'll let Jeanette take over from there.
All right. So some of the most recent news coming out of Conway Regional. So once again, Conway Regional was named one of the best places to work in 2020, which is no easy feat, being in healthcare and during a pandemic. So kind of talk a little bit about the environment there, and how does it consistently win this best place to work?
It's a really important part of our story. When we think about all that we've accomplished over the last several years, I would say if there's one thing that contributes to that success the most, whether it's our growth and expansion or achieving magnet designation from the American Nurses Credentialing Center, that engagement really is what it all comes down to. When we talk about engagement, we don't talk about satisfaction. I hope staff are happy. I hope they're satisfied. But really what I want is their engagement. I want their heart. I want their alignment of values. When we achieve that alignment of values, we get staff who want to go above and beyond, who really care about what they do. And that really is at the core, I think, of our strength as a hospital and health system, and something that we work on and are very deliberate about every year and really all the time, because we know that if we've got an engaged workforce, there's really no challenge, whether it's a worldwide pandemic or challenging financial situation that we can't overcome. And that's really been a great story to tell, and really central to who we are.
Well, speaking of that, kind of meeting the challenge of a worldwide pandemic. So when Arkansas was at the height of hospitalizations, one thing that Conway Regional did, you kind of pivoted. I think your rehab center there, you guys converted that. So talk about, some of the changes that you had to make.
It really is kind of an interesting story. So when I look back, and I actually was looking on Facebook here recently, and I got some of the 1 year ago posts that we had, and it just brought back a torrent of emotion, if you will, to look back on some of those early days when the first case in Arkansas, I think, was the 11th.
March 11th.
March 11th. And we activated our incident command center. I went from thinking we're really overreacting here to about 2 weeks later, counting the number of ventilators we had in-house, planning for what was then, pretty much experts agreed was going to be the height of the pandemic around the April timeframe.
Yeah, I was looking back a year ago for our editorial, and I saw that, they said that it was going to peak in April. And so, yeah. Anyway, sorry, go ahead.
Well, and, things as an administrator, as a leader, go through your mind. Do I have enough staff? Do I have enough beds? Do I have enough ventilators? What happens if I have to start to rationalize, who gets ventilators and who doesn't? Where are we with the medical staff? Are they supportive? And a bunch of planning went on around that March timeframe, March-April timeframe. And then, as I think we all know, we weren't overrun. In fact, people avoided the hospital. They didn't come to the ER. They didn't go anywhere. And so we had a completely different challenge to face, which was your business evaporated 45% of its revenue overnight. Yes. And then how do you respond to that in a way that's culturally appropriate? Because I think a lot of organizations face that challenge. They laid people off. They canceled contracts. They backed out of a lot of commitments. And I didn't want that to be our story. So that's one track. But that plan to use the rehab hospital as an acute care setting was really born in that spring timeframe. It's about a year ago. And we kind of put it on a shelf and said, that's nice to know it's there. And then around, it was towards Thanksgiving, we started, having challenges with beds. One thing to realize with COVID, you've got a cohort patients, right? You're not going to put a COVID patient next to a hip replacement patient or, a patient who may have had a heart attack. You've got to put all those COVID patients who may have any range of illnesses in one area that we can protect and close off. And so, how we grow COVID meant that we had to shut off, maybe 20 beds or a unit, which meant that those beds weren't available for normal med surg patients. And so it made planning for the beds kind of a challenge because you had some beds that were just offline, you just couldn't use. And so that's what really necessitated using the rehab hospital, because we knew that we needed to begin setting aside more and more beds for COVID, even though our census may, hit 30 one day and 20, 3 or 4 days later. So we needed to be flexible. And that's what prompted us using the rehab hospital. We are licensed for 150 beds, and there were times where we were in the 160 range from about Thanksgiving through, I would say, mid-January-ish. So it was quite a challenging situation. And I think, you mentioned being the best place to work and the role and the power of having an engaged workforce. We went from a census of about 40 during the low point of the pandemic, I guess, to a census of 160 at the high point, all within 7 or 8 months. And so, normally in healthcare, we like to say those are good problems to have, right? That's growth. And we love those kind of problems, but not this kind of problem.
Right. No, absolutely. Yes.
Right. You mentioned that people weren't getting treatments or weren't coming to the emergency room or weren't coming to get, I guess, things that could wait done. Do you foresee or are you experiencing a higher volume now that people can deal with that?
It's anecdotal to say. I hear from our clinicians that patients are getting diagnosed with cancer at later stages. We're not doing the number of screenings that we were before, at least during the pandemic. I'll say that we are now. But COVID didn't cure cancer, so people are still getting cancer. They're just getting diagnosed. Their diagnosis is being delayed by several months. I've heard anecdotally of stories of which is really kind of fascinating to me. Where people, who may have some cardiovascular disease aren't having heart attacks, they were having pulmonary embolus. So that clot is just progressing to another part of the body. People aren't getting up and moving around during the pandemic. So they're not having heart attacks, but they're still sedentary. So those vascular issues are just manifesting in different parts of the body, which oftentimes are very hard to diagnose. I think we've done more, pulmonary embolus cases at our hospital in the last 12 months than we have probably in the last, few years. So it'll be interesting, I think, in retrospect, and I don't know when that data can start to be culled, but several months or a year from now, and look back and just really attest what that
kind of butterfly effect of
and of telemedicine, which I'm sure we'll talk about here in a moment. But telemedicine is a great thing.
That's my next question. Yes, absolutely. So that's what I had written. So the pandemic really drove telemedicine forward. Is that something that you see, kind of continuing? Maybe not at such a high volume, but what's your take on that?
So I've been in healthcare for 20 plus years, probably now 25 years. And my entire career, and I'm sure it predates me, I know it does, there's always this talk about telemedicine. That's going to be the next greatest thing. And but it never really took off. I think 10 years from now, we will look back and say, the pandemic was the birth really of telemedicine. And we've seen an explosion. We went from really no telemedicine visits to now, at least in our primary care clinics, about 20% of our visits are via telemedicine. So it's a great tool to extend and expand care. I think if you were to talk to physicians, which I have in several occasions, there's only so much information you can get from talking to somebody over a camera.
Sure.
Only so many things that you can assess. There's only really so much that you can get from that medium. So I believe it will continue in somewhat of a hybrid form. If it's your basic medication refill, if it's a patient that's well established, having a telemedicine option is probably a very, very good one. But clinicians learn and they practice their trade by laying hands on people, actually listening to the heart and that kind of thing. We have seen certainly. Telemedicine has brought down the acuity of visits because obviously we can't do lab tests that way. We can't do x-rays. So there's just limited info you can get. But I think it's here to stay. And I think it's overall a very good thing.
On the other hand, there's some people that might be apprehensive of getting in touch with a doctor might be more willing to do so.
Yeah. And I think not just that, but it's a generational thing too.
Sure.
Younger folks don't. I think of my own kids. They don't have a well-established primary care physician, and oftentimes, and I think this is not a good thing, but they don't feel like they need one, and so it's as I like to say, it's the pizzification of healthcare. It's that Domino's pizza, 30 minutes or less, get you in, get you out. Consumerism, however you want to phrase that, but. I think there's good things and there's bad things to that. But apprehension, a person is just more likely, they want it when they want it. And so telemedicine gives them that option.
All right. So what impact did the pandemic have and is still having on some of, like rural hospitals, versus like more urban hospitals?
I think in rural communities, it was pretty profound. When you've got to shut down, when you're a 50-bed hospital or a 25-bed hospital and you've got to shut down 5 or 6 beds or however many COVID patients you have, it is a significant cost issue. It's lost revenue issue. And those communities really are ones that function well, do so off of primary care. primary care, that internist or that family practice doc in that community is the lifeblood of that hospital. And oftentimes when that practice shuts down, that has a downstream effect on the, small rural hospital. They have, at least in my sense, I think by and large have fared, fairly well. We have a hospital that we manage in Dardanelle. We tested there, probably 15,000 COVID patients there. There are a lot of poultry industry. Tyson is up there.
Oh, sure.
So, they had really early on a pretty significant outbreak.
Yeah, that was a hot spot early on.
Yeah. And so, I think critical access and community-based hospitals really showed, their role in the community by being there to help with testing, which really was the only tool that we had to fight this thing for the last, 9 months up until, Christmas, Thanksgiving timeframe. So testing was vitally important. And, thank goodness we had resources like those smaller community hospitals to help with that. I think the CARES Act funding helped those hospitals tremendously. We have a lot of small independent community hospitals in Arkansas, and that is a tough burden to take on, absent a larger Big Brother support,
Absolutely. So speaking of the new tool that came out around Christmas time, the vaccine, we have 3 now that are approved in America. But the governor opened up a couple of weeks ago. He opened it up to all Arkansans 16 and up. So has Conway Regional, have you guys seen kind of an increase in demand since that happened?
Yeah, it was interesting when the vaccine first came out. Of course, we got inundated with phone calls. Everybody wanted it. And, understanding the rules about who was going to get it and how it was going to be rolled out wasn't exactly universally understood. So we've gone through various, periods where we had huge demand, and then we kind of met that initial demand, and there was sort of a plateau, after teachers and this 65 and up were vaccinated. We had kind of a period where it was sort of quiet. Now it's kicked back up, and we're going gangbusters. We have to date vaccinated. It's over 14,000 people, and still going. Still have a clinic on our campus. We're now starting to push out vaccine to our clinics because we need more points of service. Sometimes when we have a vaccine clinic, we will vaccinate 600-700 people a day. And that's quite a burden on our campus.
Oh, sure. Absolutely.
But yeah, it's a really good thing. And we need to, I commend the governor for pushing that out. If I've learned one thing from this pandemic, there are 1,000,001 critics, and certainly people who want to step outside and say he should have done this differently or he should have done that differently. But it would have been great if we had gotten to this point with universal vaccinations earlier. But I can't.
Oh, certainly. And our editorial board at the Log Cabin, we agree. We had written, saying, hey, please go ahead and open this up to everyone. And then we did commend the governor for opening it up when he did. We were like, this is a good thing. Anyone who wants it should be able to get it. So
yeah. I'm glad that's those decisions and the decisions that he's had to make over the last 12 months
I don't envy him.
Not mine. Yeah.
It's a balancing act for sure.
I thought he did a great job, though. I watched those press conferences every day. He had a lot of stamina to deal with that.
Oh yeah. And again, to deal with those critics, I can recall getting in a debate with someone about COVID, really, and this was probably 8 or 9 months ago, and is this really a big deal? And aren't we overreacting? And the governor really needs to open it up. And I said to this person, you may be right. I mean, I don't know. But if you're wrong, people are going to die. and it's going to be directly related to your decision. So is this something you want to make? I mean,
I may not get in an accident today, but I'll be wearing my seatbelt.
Right.
There you go. There you go. Absolutely.
Yeah.
All right. So speaking of, people who want to get the vaccine, there is still some resistance, especially in the rural areas. So help us, dispel any myths that are out there. What are some of the things that you can tell listeners about, this is true of the vaccine and this is not true?
I think data is our best weapon, and it's the thing that we need to lead with when we talk about the vaccine. And the reality is that side effects, complications from the vaccine have been incredibly, incredibly low. Mm-hmm. And we've now vaccinated in this country, obviously, millions and millions of people. So the fear or the concern that this is somehow unsafe, I think, is just not warranted by the data. And I could take a stab at giving you a scientific explanation at that, but I'm not a scientist. I'm a hospital administrator. And so
your children told us you were a doctor.
Right. Yeah. At home, I'm free to give whatever wacky opinion I have. But here, I'll try to maintain myself. I look at the data. And in fact, when we first offered this to our staff, one thing we did was we said, if you get the vaccine and you get COVID, we'll pay for your time off. So before then, if a staff member got COVID out in the community, which was the overwhelming majority of the time when our staff would get infected with COVID, they got it from the community, they had to take their time off. They had to, go into their vacation time. But I am so confident that I said, if you get COVID, I'll pay for your time off. Right. So the data speaks for itself. It's not a mark of the beast. It's not something that is going to cause you to grow a tail. I don't have a tail. It is something that is very, very good. It allows us to return back to normal. It's going to allow us to, move forward from this pandemic more expeditiously. And so I guess that's just the thing I would say. Look at the data. Study the data. It's
odd to me that people, not to make an opinion on it, but the people are so upset about this vaccine when we've had so many in our lives already, Yeah. It's not the first vaccine you've ever taken.
Sure.
Yeah.
Right.
It is a little different in the sense of how, the vaccine is developed, in the sense that it is a component of the DNA. So, you're not getting a live virus or even a dead virus. You're getting a component of the RNA that your body, helps to identify and fight. But, that has been under development and really been contemplated for, 20 years. So it's not new or novel, really, to hear clinicians talk about it. And you can go to our website and see some of our physicians talk about it. It is really brilliant what they did and how they came up with it. And that's the thing I would also say, to people, when you're sick, when you're in a life and death situation, you go to the hospital and you ask a doctor to heal you, right? To do something to save your life or to make your condition better. I can't tell you how, to a man and woman, supportive physicians are about this vaccine. I rarely find, and I've got to go out on the internet to find them, physicians that don't support it. Right. So I even had one physician tell me, early on in the vaccine process, he said, Matt, if I got to take that vaccine in the eye, I'll do it. I mean, wow, that's commitment.
Well, that is commitment.
So, if I'm going to trust that man or woman to save my life, I think I'd trust their opinion on a vaccine. And,
absolutely. Speaking so the website, what is the website that people can go and kind of see the more information?
It's just, conwayregional.org. Okay. There is a specific, COVID information that you can access there. You should be able to select a time if we still have slots open for this week to get a vaccine. You can also access other videos and other information about the vaccine from interviews that we do with our physicians. We've got pretty extensive social media presence as well. So if you go to Facebook and and go to our Facebook page. You can see a lot of those interviews, which I think our communications team has done a phenomenal job to be proactive about messaging and getting the word out there.
All right. So let's switch gears for a minute. Let's move away from the pandemic like everyone wants to.
Yes.
Okay. So Conway Regional a few years back announced a $60 million expansion project. And, this was kind of the big story in healthcare around here until the pandemic. So what is the latest on that?
We're well underway. I was trying to think of a percentage of where we are. We started our critical care unit that actually will go above our OR. I'm sure everyone, if you've driven anywhere around UCA or the hospital, you've seen the crane, and very excited about that. That process began a few weeks ago. We have almost finished our Greenbrier Clinic expansion, so that if you've not driven past that building, we essentially increased the footprint of that clinic site almost 3 times. It'll have physical therapy there, expansion of other specialty services and primary care physicians. We also will soon start what's called our continuity clinic, and that is a clinic for family practice residents to see outpatients. Continuity clinics typically take care of the underserved in a community, and very proud of the fact that continuity clinic will also have a dental clinic attached to it. The Interfaith Clinic had, many years ago, if you all have heard of that, Interfaith Clinic had a dental clinic attached to it. We took over that dental clinic a couple of years ago as St. Vincent, pulled out, and it'll be a really awesome asset for our community and training ground for our physicians. So that continuity clinic is also part of that capital expansion, as well as a new pharmacy and a new lab. So it is well underway. It is really, it has been scary, to contemplate that. I know you said we were getting away from the pandemic, but to think about, expansions of that magnitude in the midst of a pandemic.
Oh, sure.
Took a lot of courage on the part of our board to move forward with, but it is really, really exciting. And it's exciting to see that growth, coming out of the pandemic. I was walking into work the other day, and it was the first sunny day we had past, what we call Snowvid,
Yes.
or Snowmageddon. And it was a beautiful day, and they're working on the girding, the steel frame. And it was just, what a great reminder of who we are as a team and what we're accomplishing. And to see, that we're still moving forward, and I think it's pretty cool.
Speaking of snow, but I'm going to embarrass you for a second. But so one of your workers caught you and put it out on Facebook. So you were out there like scraping ice off of your staff's cars. And so, maybe your leadership is part of what makes Conway Regional one of the best places to work.
Well, thank you. I first did that a couple of years ago. We had a bad ice storm, and for administrators, our world stops. We don't have any meetings, so it's ice days can typically be a pretty quiet day. And I always feel compelled that if I'm going to ask a nurse to roll out of bed at 6 o'clock and drive through snow and ice and potentially putting his or her life in jeopardy, I ought to be able to do the same. That's just, so I always make it a point to be there on snow days. But a lot of times my meetings are canceled, so it's like, well, what do I do? And I can't be a nurse. I can't work up on the floor. So I can go scrape windshields, and so it's kind of become my thing. However, with that stupid snowstorm lasting 2 weeks, I couldn't be out there every day. It's like, when is this going to end? I don't think I have the gloves thick enough to withstand that. But yeah.
So one other thing that I saw during the early on in the pandemic, that to me, it was just really encouraging for us here at the newspaper. But so a lot of, the community has been very supportive of healthcare workers, and, from like food trucks coming and feeding, the employees, and like people just having parades and, standing out there with signs, kind of talk a little bit about the impact that had on your staff.
If you look back, and think about that time, there were so many hospitals and messaging out there in healthcare that was just, flat depressing. I mean, it was really, scary. And we were very deliberate that we weren't going to take that posture. To quote Esther 4:14, this was the moment for which we were made. If you look at the history and progression of American healthcare, the church mission, going and serving the underserved, taking on pandemics. This is what we do, and these are the moments for which we were made. So we shouldn't cower from that. We shouldn't go sulk. We shouldn't be anything less than absolutely bold about, hey, we're going to beat the hell out of COVID, and this is how we're going to do it. And let me just quick sidebar. Since I am an Aggie, we have a thing where we beat the hell out of whatever team we're playing. So that's just what that is. But anyway, so we're going to beat the hell out of COVID, and that's not a posture of we're scared, we're fearful, we're whatever. We're going to take this thing on. And so was it hard? Yes. Were our staff burned out? Oh gosh, absolutely. I don't find utility in dwelling on those things. We acknowledge them. We put our arm around those staff when we need to. We offer to help. But at the core, we have to really lean upon, what got us into this field in the first place. And that is to answer that call and serve others. So that was a very, very deliberate posture that we took and continue to take.
Excellent. All right. Well, I always ask, is there anything that I haven't asked about that you just want to, talk about?
Oh gosh, I think we covered the big things. Okay. For us, we continue to focus on our graduate medical education. We will be very proud to bring on 4 new family medicine residents this July, which are going to be great additions, 3 females, 1 male. All of them, with the exception of 1, have a tie to Central Arkansas. So continue to tell a great story with that. There are probably close to now, in a few years when Alice Walton gets her medical school built, there will be close to 300 medical students graduating from Arkansas schools that don't have a residency in state. And we all know that primary care is really the solution, I think, to our healthcare crisis, financially and value-wise. So very proud of the work we're doing, not just to create more competent and good physicians, but physicians that really are in it for the right reasons. And I think we've got a unique opportunity there. So very, very excited about that. And continuing to grow and add services. Mm-hmm. One of my favorite taglines ever in healthcare is that we provide care down the hallway, not the highway. We are really focused on keeping patients to the greatest extent that we safely and adequately can here in Conway. And it's not something that a lot of administrators like to brag about, but we've added about 600 jobs since I've been in Conway. Mm-hmm. And most of the time we like to talk about how efficient we are and how many jobs positions we don't have. But I'm very proud of that. I mean, I think that says that we're continuing to grow and to develop and serve the community and have Conway really first and foremost as that focus. So
awesome.
Matt Troupe, President and CEO of Conway Regional Health System. Thank you, sir, for joining us here today.
You bet. Thank you for having me.
Absolutely. And thank everyone in your industry for the work y'all have done over the past year. I can only imagine how difficult and traumatizing it was. So
certainly was, but I appreciate those sentiments. Thank you.
Yes, sir. We are going to tease ahead a little bit to next week. We have a special edition of Conway on the Record.
That's right. Next week, we will have a special Conway on the Record. It is Toad Suck Days edition. So everybody tune in for the latest news about Toad Suck Days 2021.
That's right. We will have a live toad in studio.
Jamie Gates, a very important toad.
No, I didn't mean to. No. Jamie, if you're listening, I wasn't calling you a toad, I promise. ConwayOnTheRecord.net. That is our website. Go there for our contents. This podcast is available wherever you get your podcast. Give us 5 stars. And am I missing anything? I don't think so. No, that's it.
That's it.
Jeanette, Matt, thank y'all so much.
Thank you.
Thank you, Drew.